When I talk to people and they think, oh God, how can you work there? They have this impression that it's really dark and depressing. And actually, for me, it's the total opposite. It's full of light and laughter, and it really is the happiest job I've ever had.
I think when people walk through the door of the hospice, I think there's an expectation that this is going to be somewhere that's very sad.
But in fact, for most visits that we have, they're very positive, looking forward, kind of future pacing about, what we can bring, what symptoms we can control, improving expectation that it isn't tomorrow or the next day that they're going to pass.
So some patients come in as symptom control patients where we get to manage their symptoms and discharge them home. They're always part of our services, and then at a later stage, if needs be, they're readmitted to our services.
Somebody is there at the door to meet you, to welcome you, to introduce themselves to you, and to make you feel that this is your home for as long as you need it to be your home for.
Part of my job that I really love is getting the opportunity to work in a multidisciplinary team, working closely alongside the doctors, the other allied health professionals such as the occupational therapists, physios, chaplaincy.
A lot of nurses here have different backgrounds in nursing. Some people have oncology, some people have just general nursing. We really work as part of a team. Everyone brings different knowledge with them, but you're never on your own. There's always somebody to ask a question to.
Support it's ongoing, so anytime they can actually approach any of us, and we are happy to help them.
And people value that, the coming together, peer support, but also general well-being, which will be very important within the organisation.
What I think it's really wonderful in St Francis Hospice is, in conjunction with the Trinity College Dublin, we facilitate a master's program in palliative care. And that's an excellent example of supporting our staff members here in the organisation to grow further and to go further in their education if they're interested.
It can be a very sad job, but it can be a wonderful, rewarding job, because I get so much satisfaction going into people's homes. They're very fearful, they're frightened, they've had a diagnosis, but I'm hoping that in some small way I can change that fear into some faith that there's somebody there to help them.
I think nurses should come and work in St Francis Hospice because the sense of inclusiveness.
It's back to basics nursing. It's patient-centred. We're focused on the patient and not paperwork.
You're always supported, whether it's by your colleagues or by management or by the education department.
St Francis Hospice is a values-based organisation, and it's not just values that are on the wall or on a piece of paper. It's a lived values organisation, one of dignity, respect, kindness, compassion, collaboration and excellence.
Unfortunately, my own father has been diagnosed with a terminal illness and will be on our books very soon. It gives me great comfort to know that this team with unparalleled nursing care will be looking after him at home. It'll give great comfort to my family as well. That's the highest recommendation I can give for a team, so why wouldn't you want to come and work here?